All right. Thank you, everyone, for joining us today. My name is Katie Stasa. I'm the Senior Digital Media Strategist here at Community Solutions. I'm joined today by Ian Fletcher, a Community Solutions Strategy Lead who's been supporting Metro Denver's efforts to solve homelessness for over a decade. Thank you for being here, Ian. And since we only have 30 minutes today, I'm going to get ahead and start right away. But please feel free to drop any questions into the chat box as we go along. We'll try to reserve a few minutes at the end to answer them. So, we're going to start with the first question. Ian, could you please tell us about your background and why you do this work?
Sure. Thanks, Katie. Hi, everyone. Thanks for being here. Yeah, I'm happy to share a little bit. I've been doing this work, as Katie mentioned, for over a decade here in the Metro Denver community. I started out doing direct service, working on a team supporting veterans experiencing homelessness for a local nonprofit organization. I came to this work from a community organizing and a public health background. I have a strong belief that homelessness is a health equity issue. And so that's really the lens in which I approach this work. And also, I have come from a family of veterans, including those with behavioral health needs. So it's deeply personal to me to work with this population and also learn how we can expand what's working for veterans to anyone experiencing homelessness.
That's excellent. So you've been in this work for a while, very seasoned professional. So now I'm curious about, sort of how you came to work in the Built for Zero movement, and if you could explain what that movement is and how it differs from the way that communities typically address homelessness.
Yeah, so I first learned about Built for Zero when I was working in the community and was working with one of our organizations locally, the Metro Denver Homeless Initiative, who coordinates a lot of the regional efforts around homelessness, and started working with Built for Zero and really liked what was happening because I think Built for Zero is a movement that is about a system that is designed for learning and improvement, and it's not set in stone. It's not like a 10-year plan that sits on a shelf or that we can't really predict what's going to happen in 1 year, let alone in 10 years. So we're really building out at Built for Zero uh, based on a desired end state. And for us, that's this term we use, functional zero, meaning the system can house more people and more rapidly than are ever coming into homelessness. And so there's really low numbers of homelessness in a community because it's just not realistic to expect that no community will ever have someone experiencing homelessness. While that's nice, it's just not realistic in our landscape of our world. So how do we design systems that we can prevent homelessness and that we can also, even when someone becomes homeless, we can rapidly get them back into a stable housing environment? We're really working off of 6-month increments. So we know what's that desired end state. Okay, where do we need to get to in the next 6 months to make that happen? And we're adjusting for things like new funding resources, like housing opportunities or trends in the data. We're also trying to get alignment so that there's a shared mission and a definition of success that's agreed upon by the community, by electeds, by people experiencing homelessness. And that's something we don't always see in communities where they've just got competing priorities and different people are defining success in a different way.
Thank you for that background and that explanation. So, it's my understanding that Metro Denver is a Built for Zero community. I'd like to know a few things. So, how long have they been a Built for Zero community? And then also, how does such a large city, I guess, create a coordinated response to homelessness? I know that the population is over 3 million. It spans 7 counties. It's a massive area. So, when did they come into this work, and how can they kind of coordinate efforts to solve it?
Yeah, so the region really has been involved since about 2015 as part of our original Zero 2016 movement, the precursor to Built for Zero, so building systems for zero homelessness. And for a long time, really prior to the pandemic, the region was approaching veteran homelessness in a way that it was harder to account for the nuances of the specific cities and counties and needs of the geographies. So we were kind of looking at, oh, we've got this one region, let's approach it in one way. And what that didn't leave room for is, communities that have maybe a few hundred people experiencing homelessness versus a downtown metro that has several thousand. You can't treat the solution the same, and you can't treat really, like, the data is not the same, the resources aren't the same, the challenges aren't the same. And so what we started to do was look at that as, this complex problem that um, we know that conditions were changing. The pandemic, frankly, forced a lot of the partnerships to work together in a new way. And we knew that this was a regional issue, that people were experiencing homelessness, were moving across, a county line because that's where their services were and that's where their community of note was. They didn't really care what jurisdiction they're in. They're just trying to get help or go to where they know the community. But we had a hard time telling that story because we didn't have data that was really reflective of the region, as a whole. And so, an example of that was we had an understanding of, several hundred veterans experiencing homelessness, but we didn't really know which providers they were working with. We didn't know where they were staying. And some of our organizations only work in a particular geography, right? Maybe they're in only work in Aurora, or they only work in Jefferson County. And so if we put all of those veterans in the same pot, it was really hard to kind of differentiate who's serving whom. And so we launched what's kind of like a mission control, right? Everybody agreed that, we want to get this rocket off the ground, but we recognize that, there's a personnel component, there's a weather component, there's an engine component, there's a logistics component and a navigation component, and all of those things have to be working on their own in service of that larger aim. And so the VA was a really big partner alongside our Metro Denver Homeless Initiative, the Continuum of Care, to come together and say, how do we address this regionally while accounting for these kind of local nuances? And so what we did was we broke up the large region, which, as you said, was 7 counties. It's like 40 municipalities. We have 13 public housing authorities, and we said, okay, what if we made things a little bit more precise? And so we created these individual teams that are local, and they're working on the veterans who we started to identify are specific to their kind of sub-region, we call it. And they're able to really focus in not just on, 500 veterans, maybe this community has 10 of those 500, they're focused on 10 of 10. And that's allowing for a lot more coordination and ownership of the challenge and the need. Because we had the VA and their ability to see across geographies, we were also starting to get an understanding of, what movement was happening between these regions and to what end. And that really helped us identify folks who were falling through the cracks, where they, maybe were popping up in Denver because of shelter setting there, but ultimately wanted to be in Adams County because that's where their community was, but they didn't have a shelter bed there. So we were able to start understanding kind of the qualitative elements of veterans experiencing homelessness in a deeper way. And by creating a convener that agreeing everyone's a part of this, but people are going at different speeds and have different needs, that really allowed us, I think, to accelerate some of the progress, particularly in local communities where they didn't have as much of a presence in these regional conversations historically. And the other thing I would say is we're also able to understand what is a system-wide challenge that everybody is experiencing and what is really like a local challenge that, is unique to a particular geography. And I think that's allowed us to create a feedback loop where we can see, oh yeah, this funding source, because they're restricted in what they can pay for, we've got to have something that's a little bit more flexible, for example. versus, this particular community, they're really just dealing with, um, a program shut down, or they've had a higher number of evictions than other communities. So it's just allowed precision that we haven't had historically.
Yeah, so it sounds like it's a combo of kind of a bird's eye view of the entire Metro Denver region in combination with a boots on the ground approach where people are really getting into the work and they know exactly what's going on in their area, but then they can bring it back to that larger group, which I guess
Yeah.
is kind of the Built for Zero movement in a nutshell, where we take all these learnings from different communities and bring it together, where they can take all these learnings from different regions and bring them together. So that's awesome. I'd love to dig into Metro Denver's data since you touched on it when speaking about how many veterans are experiencing homelessness in that area and kind of how the region separates who is, working on which veteran's case. Um, Metro Denver has this really incredible number that I see here. They reduced veteran homelessness by 30% in about 4 years. So I'm curious to know how many veterans has the community actually housed in that time period? Can you speak a bit more about this incredible data and kind of how they got there?
Yeah, so I think one of the first things is that number, that 30% reduction, is based on actual individuals that we know by name. It's not based on the annual census count, which is aggregate and kind of de-identified. And so I think what's critical there is we're using um, a number and a data set that we're more confident in, because they're individuals that that we can point out exactly who's experiencing in a homelessness in the community. So from the data, we know that at least 1,874 named individual veterans, some of whom are just representative of a family at large, some of whom are just individuals, were housed over that 4-year time period. And because we have a really strong data infrastructure in Metro Denver, particularly around veterans, we are able to account for who is falling into homelessness and start to understand why. Are they newly homeless, where this is their first time experiencing homelessness? Are they new to the homeless system? Maybe they've been homeless, but they haven't engaged with traditional homeless service providers or outreach. Or have they been housed through our system and are now returning to homelessness? So the housing support that was provided, didn't meet their needs, and so they're ending up homeless again. And those are different challenges, and you solve for those in different ways. And if we treat them as kind of a lump sum, you know um, solution, then we're not accounting for that person who's been homeless a long time, and the person who's newly homeless, who maybe had a recent eviction. Those are two different situations, and they require different ways of supporting someone. We're also able to see that you know our trends around things like race equity, which frankly we're not there yet. We know that Black, Indigenous, and people of color are overrepresented in our system, and we're trying to move the needle on those things. So it's not just enough to house everyone if you're not doing it in an equitable way. And our communities come a long way in really improving the equitable outcomes, but still has a way to go. And we're also seeing things like the fact that we have several programs that can serve not just the veteran as an individual, but their family or their caregivers as well. And I think that's really critical, recognizing veterans as a widely diverse group of people. Um, Being able to support people outside of them. What I'm really excited about is, we've seen that this is possible for veterans. That 4 years is during the pandemic, when all of these partners who are doing this work were laden with additional crises and additional challenges, and people experiencing homelessness were laden with additional crises and additional challenges, and yet we were still able to make meaningful reductions. And I think that, by showing we can do this for veterans, Built for Zero, one of our kind of core principles is leveraging veterans because, it is such a diverse population. We can show that this is possible in communities and expand and extrapolate what we've learned to non-veteran populations, like people experiencing chronic homelessness, youth and young adults, families, and ultimately everyone. And here's what works for everyone, and here's maybe what works just really well for youth. And we have to be able to account for those things. So the other thing I'll just say here is all of this credit goes to the partners and providers doing this work on the ground day in and day out during the pandemic, after the pandemic. For many of us, the pandemic isn't over. The resources may be more limited, but the crisis is really just emerging. And so our partners who are doing rapid rehousing, our partners at the VA, our public housing authorities, our outreach workers, that all of those housing placements and people who got housed is really just as a result of their dedication to this work.
Absolutely. Yeah, it's a true constellation of all the different agencies that touch on this problem. I think that a lot of people don't even know how many people touch homelessness in a community. So it's important to call that out. Another thing that we talk about a lot is we always use the saying, you can't solve a problem that you can't see. So that's really where that data piece is. I know that you mentioned that Denver is really focusing on that data component. They've improved their data infrastructure. Is there anything that their data is telling them that's helping them solve this problem a little bit better?
Yeah, so we have 9 subregions, 9 of these localities. Over half of them have achieved what we call quality data, which is the kind of assessment that tells us there's a really, really strong confidence in the data. And the other 4 are almost to that quality data measure. They've all made great strides towards this kind of comprehensive visibility on veteran homelessness. And what are we seeing? We're seeing getting an understanding of the challenges of inflow, people entering homelessness for the first time that aren't necessarily known to the system and who don't necessarily know how to navigate all these different partners and regs and different systems. We're also seeing that for example, over half of the veterans accounted for today on our actively homeless list are older adults. And that is data that we've seen that uptick over time, but not to that extent. And so, what are the needs and supports to help those older adults who may not just have a specific apartment, but they need someone to come in and support them in that apartment. They might need long-term or nursing care. They might need geriatric supports that are more connected with their aging, that's compounded with their homelessness. So by understanding those sort of factors, being able to try to find either new resources or adapt existing resources can be really critical. We're also seeing, what are the programs that are working and why? And then, maybe there are programs that, particular elements of that program are working, but we're seeing, oh wow, the length it takes to get someone enrolled in the program is tough. So, we want to get that lower so that it's just easier to navigate and access. So what could we do to kind of streamline those processes? So all of those are just examples of kind of elements that we can use from the data, in addition to being able to show, a specific subregion's progress towards that end state in service of the regional goals as well.
That's excellent. So I'm seeing a lot of comments in the chat right now about housing, and that pivots very well to my next question. So, of course, housing ends homelessness. So I'm curious to know how Metro Denver is connecting veterans with housing that is helping them stay housed.
Yeah, so I just want to emphasize again that housing ends homelessness, and that homeless people are not housed. And so really ultimately the thing that we've got to generate all of our energy towards and around is housing, in addition to the supportive services and those things that can help individuals and families thrive in their housed environment. And so, looking at our data, we're able to see, like I said, who are we putting all of this effort to get them housed, and then maybe that housing support, maybe it's a more moderate support, wasn't enough for this family in the way that we predicted. How can we rapidly get them into a higher level of care, which in our kind of lingo is typically permanent supportive housing? And we have mechanisms by which our data and our staff, actually our individual teams locally, can use what we call case conferencing, which is where we have teams come together to just kind of run through what are some of the barriers that individual veterans are facing, and how are we going to clear those system barriers so they can do things like, say this veteran, we've tried this service, 3 times, and we're really just not seeing it meeting their needs, and they've had a change in their income, and so we're really going to need something different. And being able to adapt in that way is really, really critical. Community Solutions has made considerable investments in affordable housing, and trying to drive those system improvements, not just in our own kind of affordable housing that our organization owns, but to expand and enhance those improvements across the region. And so we've been able to, in partnership with our VA and our local providers and public housing authorities, test different ways to get people connected more quickly and more effectively. So, does it mean like having an event and inviting people to come to that event and you just knock out who you can at that event? Or does it mean, reducing a paperwork requirement where that's possible? They're testing everything possible to get people rapidly connected. And I think, again, that's what Built for Zero is all about is, there's not one way, but as long as everyone's in agreement, that housing is this end goal, and we're all driving towards that, what are the improvements we can be continuously making, even as the ecosystem and environment might be changing outside of our control.
Yeah, thank you for adding that. And I just want to add that I had the privilege of attending a veteran stand down event in Denver a couple months ago. And it's true, the staff on the ground that was running that event, they were working with veterans directly and signing them up for housing right then and there. The system is really working in support of veterans, trying to create the least amount of barriers to housing, which was awesome to see on a community level. That's excellent. And just a plug for our annual Impact and Learning report, as Ian was talking about some of the housing that we've acquired in Metro Denver. There are many, many permanent supportive housing apartments that are in the Metro Denver area that the local team is connected to. I just read a stat earlier today that across the nation, there are now more than 1,300 units that have been acquired for people either exiting homelessness or renting at market rate to maintain affordable housing in the area. So the next question that I have, it sounds like Metro Denver is really leading the way as a large city that's working to collaborate and solve homelessness. I'm curious to know how other large cities can replicate that success, and if it can work for other communities across the nation.
Yeah, I think some of the kind of key elements that we've seen across, like I said, this is a metro-wide area. There's not a single authority over everyone. Lots of different electeds and different politics and different resources. But I think when we can get everyone oriented towards that same goal, have an understanding of those like specific geographic constraints as well as the assets, and look at the trends on a more frequent basis than that kind of annual census count, it'll really start to understand the interconnectedness that I think some of us feel, but it's hard to point out. We also say like use a framework that already exists around regional coordination or coordination that folks are familiar with, especially leadership that isn't connected to homelessness. So if you have, a regional aging initiative or a regional transportation initiative, the way of working and that kind of structure is really familiar to many people in the community. And so, what if you could just replicate that, but instead of aging or homelessness, just aging or transportation, insert homelessness, right? And how would partners start to work with each other differently? Um, Additionally, we've really mapped out the processes from A to Z for what does it take to get a veteran housed through different resources or different partnerships. And that can give visibility to all the parties involved in that, really complex challenge involved and understand their individual role within the broader system and ultimately centers the veteran at the center of that work. When we map this out, right, it's pretty complex, and so we often kind of reflect, wow, we're really close to this work. Imagine if you were a veteran in crisis trying to navigate all of this stuff. So how do we start to, celebrate what's really working about this process, but really hone in on what are we hearing from veterans, what are we hearing from providers and partners that isn't working, and start to improve on those elements as a way of moving the needle across the whole. And then finally, I'll say, feedback loops between the various stakeholders and leaders at all levels, from frontline caseworkers and people living on the street or people with histories of homelessness, all the way up to CEOs and electeds. There has to be that feedback loop so that there are not decisions being made in a vacuum. And really understanding the impact of ultimately who's going to feel the biggest impact from those decisions.
Awesome. Thank you. So, with our 3 minutes left, I think that we have time for one audience question. And this one actually comes from a data analyst in Metro Denver. So, she asked, as the community gets closer to functional zero, does that mean that some veteran programs will no longer need to exist, and or if funding for those programs will decrease? She's thinking specifically in relation to emergency services like shelters and GPD rather than permanent services like VASH.
Yeah, this is a great question. And so I think what we would want to say is like, um, we don't want to see programs, being reduced or lose their funding, but their priorities and who they serve might shift. And so as a community starts to have fewer and fewer people experiencing homelessness, the effort, rightfully so, should shift towards prevention. And so maybe those programs like shelters or transitional housing, maybe they start really looking at, okay, we've got more older adults, like I mentioned, as a particular subset of a group. How do we start thinking about how our program can better serve older adults who we know, are going to just continue to age as part of this segment of folks. So I see it less about like reductions in program and right sizing programs to meet the needs of the community. So as a community needs less emergency shelter, hopefully the resources invested in that shelter can be put towards, prevention or other elements that are reflective of the need currently.
Excellent. Thank you, Ian. And that brings us almost right to the hour. And I believe we touched on every question that the audience had. So that was very informative and interactive. So thank you for everyone that joined. And thank you, Ian, for your insights. If anyone on the call today has questions that come to you later tonight or tomorrow, you can reach out to comms@community.solutions. I will work with Ian to get you the answer of whatever question you might have. If you want to know more about Metro Denver's work or the work of Built for Zero communities, our general website is community.solutions. We also just uploaded a ton of great resources about Metro Denver's work in particular, in addition to our impact and learning report. So check it out. Just thank you all again. Look out for some social media content from this session, and it was great to have such an engaging audience.
Thanks, everyone. Appreciate your time and engagement, and keep carrying on this message because this is solvable, and we just got to do it together. So appreciate you.